right, I think we're ready to rock and roll. Hopefully everybody is coming online here. Just had a little technical difficulties to get everything set up. So we are doing Facebook Live with Dr. Potter at Sanctuary Functional Medicine. We are going to be talking about our vision, our approach to care, and getting to know each other a little bit. I'm going to take one moment to, they've got a new thing on Facebook that every time you get used to one thing, they change something else. So I'm going to make sure I can get up here where if, as any of you are sending in questions, I can answer those. So I just need to pull those up 1 second. There we go. All right. I'm ready for comments, but let's take a minute. Again, I'm Dr. Eric Potter, Functional MD from Sanctuary Functional Medicine. We provide care, helping patients live healthier, more abundant lives, even though they have been faced with chronic illness. We also offer other courses about immune system and are working on other courses to reach as many as we can with the benefits of functional medicine, treating the whole person with the best of conventional and natural medicines. In this video, we're going to talk about how we approach care at Sanctuary. We know that many of you are facing chronic illness, and like most of us, you're facing times that are uncertain with 2020, with COVID-19 and its effects on the economy. You are already suffering, and now this economy and COVID-19 may be making it harder for you to get the care you need. So we are looking at ways that we can reach out and meet you in the middle so you don't have to wait another 6 months or 12 months after you've already waited a year, 5 years, 10 years looking for answers. Because we help patients that are in those situations where they have been around. You know, it's when we have the patient come in and says, "Oh, you're my 20th doctor." We are glad to be there and helping patients. So we want to, yep, got a few people. If any of you are having trouble hearing me, do let me know that in the comment section and I'll change the microphone or speak up. But as I was saying, we want to find ways that we can provide as much care to as many people. Now, the way we do provide care is in a comprehensive treatment program. That's where we're doing a deep dive. We are digging into patients' health stories, what is causing them, the root causes that has made them suffer for years, some months, years, sometimes decades, and looking for what are the different things. You know, one provider may have found this, another one found that. We want to find all those issues and knock those off till a person's health goes back to the way God meant it to be. So with that, our comprehensive program is a set of visits where you're paying up front for about 8 to 10 months of care. Visits, portal access, discounts on supplements, discount on labs, opportunities to interact with us and get help along the way. You know, kind of like an ICU, you push a button, we are able to respond. Now, not as fast as an ICU, like you're having a heart attack, but we're with 24 to 72 hours, you're getting answers rather than waiting months to get in with your doctor for the next visit. So with that, it's intense, and it takes a lot of time and effort. There's a lot of things that go on behind the scenes that patients don't even realize to make that work. But on one hand, sometimes patients are like, "Oh, I only have some stomach issues," or "I only have a little fatigue." Sometimes that fatigue may have 5 things underneath it, so it's not usually that simple. May still need our personalized care where we create that personalized program, individualized, personalized just for you. However, there are those, "Oh, I just got smaller problems." We're looking for ways, and we'd be open to ideas, hearing back from you to reach more. We're also working in classes where patients can learn, or people who aren't ready to be patients or who just want to learn about, say, their immune system, which is our main course we're doing right now called the Immune Prepper. Prepping for 2020 and beyond so that you're ready for whatever crazy infection comes next in line. As we know, 2020 has been quite a roller coaster of a year. And looking for other ways, potentially doing group visits where we can sit down with a group, do some tests, do physical exam. You don't get the one-on-one. Now you can, in those we'll probably have it where you could have the option to pay a little extra and have a one-on-one visit. But you could learn, take care of some issues when maybe right now you aren't ready for that full program or you want to test the waters a little bit. We're looking for all the ways that we can help as many people in our community, Franklin area, middle of Tennessee, across Tennessee, and we care for patients across many states. Pretty much occasional patient from California, patients from Florida all the way up to New York, coming down, definitely Ohio and Indiana, obviously Kentucky, Tennessee, Alabama, Georgia, Mississippi, those that are around us. We have a lot of patients, a few from Texas, that's the other place. A lot of people that travel, and then we're able to see them once and then take care of their needs from a distance. Occasionally, once a year at least, you have to come back so we can continue writing prescriptions. But we can do a lot of work over the internet. Everybody's a little more used to Zoom now. But we can do these things so you're not having to physically be here like you might have to in the old days before we had technology. Technology does have its good side. Downside, but has a good side as well. So with that, we've already tried to find as many ways, whether it's through technology, doing secure visits over the internet so you don't have to travel here as much, using ways, the portal to access easier, making it easier for you to get supplements at good prices by giving you basically a full discount. When you're buying supplements through our online store, you're not getting, not having to pay us anything, you're just paying the company that provides that service. So we look for those ways, and we're always looking for ways when patients give us feedback to do a better job. We want to be the best at what we do, and we want to be the best at helping people live healthier, more abundant lives. So with that, I wanted to do that. One of the reasons we did this session was if you have questions, and we're going to have another session next week, Facebook Live on Thursday, my usual time, but knowing that not everybody can do the middle of the day on a weekday, we wanted to open up some evening time, and we're looking at what times prior have been doing once a month, Facebook Lives, looking at giving a couple of options, so twice a month, that you are able to ask me questions before you decide if you want to come in and get help from us, or just get to know me a little bit more better. So with that, as we said on there, shoot some questions. I want this to be not just me talking, but I want this to be an opportunity that you can know, okay, what is it that Dr. Potter does? What is it that Sanctuary could do for you? How do I approach different problems, fatigue, headaches, GI issues? The things we take care of for patients, I could start pulling things out of a hat, but I want this to be something that is directly beneficial to all of you or to individuals in there. So waiting for questions. I can, those of you know me, I enjoy talking about functional medicine. I enjoy talking about how to help patients. I can talk for quite a while on these things. All right, so what I'm going to do while I'm waiting, if anybody does have some questions, you can share that with friends or let other people know that I'm here to answer those questions. Let's talk a little bit about immunity, since that's one of our big things right now, whether it's you're facing the threat of a viral infection, whether you believe in it or not, you are also facing everybody else's fear of a viral infection. And in our immune course or other webinars on our SFM Power site, I talk about one of our biggest issues is not just the virus, but the fear that it engenders and has sent our economy, our nation, our world into a tailspin. And what I want to do is just help people with the immune prepper course understand, so that way you don't have to be swayed when you're hearing things on the news media. You don't have to believe all the hype, but you can also be aware and prepared is the way I like to say it. So you're aware that there's a virus, and if you happen to be in contact with somebody with that, what are some of the things that you can have done to prepare yourself, whether it's vitamin D, zinc, vitamin C, or you can prepare yourself to not get sick after you've been exposed because you've already been taking those, and you know you can go up on the doses a little bit. So we do have an immune prepper book on that website where you can get that, or you can watch the webinar as well. That's about, I think it's 45 or so minutes about your immune system. Or take the course, which is more close to over 6 hours worth of information about that. Right now, what I can say is the way we approach immune health in our clinic is we take care of a lot of patients who have immune issues, whether it's immune suppression, whether it's autoimmunity. So with immune suppression, that means your immune system is not as strong, and if an invader breaks in, it's not able to defend you as well. And with that, that invader may get the upper hand and start causing symptoms of pain, fever, swelling, redness, dysfunction, inability to do your work because of those symptoms, the malaise, feeling just the fluish, yucky feeling, the icky feeling. We want to help those have a stronger immune system by getting out of the way those things that are causing them to have problems, so you get rid of toxins. Sometimes it's other infections that are suppressing the immune system, allowing other ones to get in, opening the door for second and third infections, what we call co-infections or opportunistic infections. In those cases, you treat that first infection, say Lyme disease. We do a lot of that. And you will see, oh, it's easier to treat their yeast. It's easier to treat their Epstein-Barr, EBV, chronic infection. Sometimes it's treating the yeast, and it helps heal their leaky gut, so then their dysbiosis, causing some irritable bowel symptoms, get better. So we are working with almost every single patient in some form or fashion with their immune system. And as I said, on the other hand, autoimmune, immune suppression is too weak. Autoimmune is it's attacking you. So you want your immune system to be attacking the bad guys. You just don't want it to turn on yourself and think, oh, your skin, your kidneys, your lungs, your liver, your eyes, your joints are actually the bad guy. Mistaken identity. In those cases, those tissues that you want to function, you want those to be healthy, without pain, without heat, with full range of motion if it's a joint. You want those to do well, but if autoimmunity occurs, your immune system's attacking itself, and you start having problems. Lupus, rheumatoid arthritis, Sjogren's, scleroderma. Those are just some of the examples of things that we treat in the office and help patients by turning down the inflammation, kind of trying to put the fire out, and then going looking for the arson. Because one of the things with autoimmune disease, many times, it's not just, oh, let's just give you an immune suppressant drug to turn off your immune system, because then it puts you at risk for getting infections. You go from one extreme to the other, one ditch to the other ditch. We want to actually get your immune system to work correctly. Sometimes that requires treating a viral infection, something like EBV. Sometimes it's Lyme can be causing somebody this week. Their ANA test has gone down considerably. The antinuclear antibody test, it's a marker of antibodies against your own cells, cell's nucleus, the central part of that cell, has gone down. She had two, one's gone away almost completely, the other one is just barely there, and that's been part of treating Lyme. There's other cases where we detox mold, so it's not just infections that can trigger that, toxins. Mold toxins will turn up your autoimmune, disrupt your immune system to cause it start firing at the wrong people. So with that, getting those toxins out of the way, modulating your immune system by turning down nuclear factor kappa B, or turning up NRF2, another factor that it's more anti-inflammatory, we're able to get someone better again by modulating their immune system, removing triggers like infections, toxins, other things. Sometimes it's food. Had some patients where just finding out that they were reacting to eggs removing the eggs and their thyroid antibodies, another autoimmune disease, Hashimoto's, seeing their antibodies go down and practically almost to normal again after having that for many years. So with that, we are looking for ways, always in patients, where we can help their immune system either be stronger or smarter, and then when there is inflammation, finding ways natural, using things like curcumin, cat's claw, ginger, glutathione, vitamin C, things to turn down the inflammation response. So we want inflammation when we're fighting disease, but when it's too much, it can cause damage. So you want to clear that up, get rid of the disease, turn off the inflammation, and get patients better. So that's a big part of what we do, is really helping patients with those immune too little, immune too much issues that they have. I have a question. All right, so want to bring up, I mentioned mold already, but Darlene is asking about if we have a crawl-space mold removal company. So there are some, depends on where you are. I don't know exactly where you live in the Middle Tennessee area. There's a few different ones we recommend. There's Franklin Environmental Services, there's Antigen, there's a, I think it's Breathe Easy Mold Removal. There are those others that we know about when our patients come in, because sometimes if it's a really big project, we might send you in one place, direct you to this business to be very helpful. If it's a different issue, if say your HVAC system is the problem, you may first need an HVAC company, and it may depend on whether there's different companies out there. You may need it cleaned, you may need it replaced. So we will guide our patients when they're faced with those mold toxicity issues or mold allergy, but mold toxicity is the one where most people get more sick. Mold allergies are a little easier to treat. We will send them to the place where we feel that they are going to get exactly what they need, not just a one-size-fits-all. Everybody goes to this one place. And then if you live at a distance, Antigen is a company that has some franchises at different places. And there's also Indoor Air Quality Association website that has some different links to people who are certified, businesses that are certified, say you're in another state. That's one way you can find that. And as far as guidelines to picking a good remediator, we provide our patients with that, just things to look for. For example, if they're going to tear out some drywall, you want to make sure that they have some containment. That means there's plastic. If they just rip out drywall and mold is flying everywhere, it's going to fill your house. It's going to be harder to clean, and even if they get that out, you may find that, oh, it's growing somewhere else or it's spread. So you want to do containment. You want to have air control. If it's a very big project, they need to use an air cleaner or scrubber and blow that air outside if at all possible. You also want to make sure if they're pulling drywall out, they don't carry it out your house. That needs to be bagged, put in some sealed containers. I've had a patient who that bag burst in their living room and spread to the rest of the house, whereas it was just controlled in one room. So you want to make sure those things. So the certain principles, if it's a crawl space, a little easier to control, but you might want to use a fan to pull the air out and blow it away while they're cleaning that out, especially if they're scrubbing or sanding things off. You also would then want to the principles of not just physically removing what you see, but also using products that will sterilize. So make sure all the microscopic things that you can't see are gone. And there's several different products out there. I'm not going to get into every last one, but there's some natural products that are citrus oil based. There's some more hydrogen peroxide, enzymatic different processes. So a lot of different products that if used correctly, which is the other thing, some of these are ones you might be able to do yourself. Some of those require kind of gas masks, even more so than going out in COVID, to make sure you're safe. It's not something that an amateur, it would require a professional to do those things. So those are some of the principles besides just, and I'll say the other thing for a mold remediation company, make sure that they give you a plan and they say, oh, this plan makes sense. If you're seeing a doctor that takes care of mold toxins, run that by them. You know, we do that for patients. I had a patient that did a visit today, and we were literally talking on the phone while she was talking. The remediators were at her house finding mold, and we were talking to her during that time and helping her know what to do with the HVAC system versus how. And her remediator sounded like was doing very well, in terms of they did the containment, air scrubber, blowing the air. They were keeping it packaged. They were removing everything and not just leaving, oh, well, just let's cut this a little bit out. No, they were getting everything, cleaning out the studs in the house once they took the drywall off. So you want somebody who knows how to do that. And it's not like, oh, it's just a little mold. We'll just spray some bleach on it. That's not going to do the trick. So we want to help patients with that and guide them in that specific instance where, oh, you need this company or this company. Or if we don't have somebody in your local region, we would say, here's the principles. Here's the things you want to ask them before you go in there. And there's a few companies, Michael Schrantz, Bill Nichols. There's some different companies. If you look them up on the webs, they are remediators. They can help you from a distance. They may guide you. They may not be able to physically come to you where you are, but they can do video visits where you're walking around your house and they will walk you through whether or not your mold program from your local remediator is a good thing or not. So those are some options. So I don't have another question at the moment. Let's do this. Let's talk about Lyme disease for a moment. So Lyme disease is common in this area. And when you look at the CDC, really every state has the potential for at least a few cases of Lyme disease. So this is just because you live somewhere, oh, well, you don't see it that much. It can still happen. And people travel. So if you visited a state, you went hiking, there's a chance that you've been exposed or within 10 feet of a tick, especially if you're in Tennessee. So Lyme disease is caused by a bacteria called a spirochete. It's called that because it's a little spiral form, very small, microscopic. You're not going to see it with the naked eye. This is not something you're going to get from sneezing on somebody, kissing them, giving them a high five, or although possibly from blood transfusion. There's question whether that's a possibility. But what you do is get this when you get bit by a bug, mainly a tick, but there's probably some other insects. Mosquitoes have some decent evidence. Bed bugs, fleas may also spread this. But an insect that carries that bacteria inside it, and when that insect bites, that is squirted out into the bloodstream, into your body, and it starts growing. And you think, oh, well, our immune system, we talked about that earlier. Wouldn't that be just our immune system's job? Kill it, take care of it really quick? Yes, but one of the tricky things about Lyme disease is it can change its shape. So go from that spiral form to cyst forms, round body forms. It can change the proteins. Often, if you one of my patients, you'll see that it'll change change the proteins on its surface. With that, it can evade your immune system. So a lot of ways that it hides. If it gets a foothold, it can get into tissues and also create something called biofilms. Biofilms are thin layers of mucus where they secrete that Lyme and other bacteria can secrete. And when your body tries to attack, it's hidden. Or when you try to give antibiotics, they won't reach into those biofilms. Now, with that, that's how it gets in. What does it do to your body? What can Lyme do to your body when you have an infection? So yes, in the acute form, you can get that nice little bullseye rash, red rings going in, concentric, fever, achiness, kind of the summer flu, sometimes people call it. But many don't get a rash, high percentage, part of the people who have confirmed Lyme don't get a rash. You may not have a fever, you may just have a little achy and yucky. Now, sometimes your body fights that off. Great, you don't have any problem. However, it probably doesn't 100%. But in those who it persists, sometimes they're sick for years. And we will see those patients who don't have an answer, or they may be, suffering for years with multiple therapies that don't really ever give them any help. So with that, what we want to do is, one, if we hear symptoms, joint pains, chronic fatigue, fibromyalgia type symptoms. Autoimmunity might be one. Chronic headaches if they get the Lyme disease affecting their brain, causing inflammation. They may have lots of weird symptoms, so we call it multi-system, multi-symptom, meaning different systems. It can be GI tract, it can be heart, arrhythmias, trouble breathing. It can be liver inflammation. It can be, like I said, migraine headaches, neuralgia pains, meaning the nerves, tingling, stinging problems with that. So we look, when we hear those kind of symptoms, and especially it's been for a while, and even if it's not somebody who is, oh yeah, no, I had a tick bite, we will look for those. So we'll do some different tests to see if your body's reacting against that, and then we'll use tests to walk through some of the simpler ones that are good screens but are not perfect for ruling it out, meaning we'll use the standard labs because insurance covers them. And I diagnosed somebody today with a Lyme, the standard Quest or LabCorp antibodies. However, that misses maybe a third to 40%, depending on who you talk to. So if I'm suspicious and they have other labs pointing towards possible Lyme and they have the symptoms, I may come back after I work on getting their immune system stronger and test with a more expensive yet more precise test that gives a better answer, where I can say if it's normal, you probably don't have Lyme, but if it is there, even though that first test, the cheaper one, didn't show it, we're going to treat it. So what I'm doing is walking through using history, then targeted labs based on their history, combining that together and deciding, oh yes, this person does or does not have Lyme, and then deciding how to treat that. Because it's not just, oh, you've got pneumonia, take this one antibiotic and you're going to be better in 7 days. Lyme disease, yes, if you catch it right after the bug bite, after the insect bite, after the tick bite, you might get rid of it with a 2 to 4 week course. But if you've had it for a number of years, you're going to want to do repeated therapies over 2 to 12 months. With that, we are using multiple therapies, not just pharmaceuticals, which we do think that those are useful, but combining with several natural therapies. The natural therapies help these work better, the antibiotics, and they also prevent some of the side effects. They also kill Lyme, lower the chance that you get yeast from the antibiotics, and people get better quicker. And we're also treating the spirochete, the round body, the cyst forms, the bacterial forms, all the different forms of Lyme, because if you only treat some and don't treat the others, they can grow back from those. It's kind of like pulling out Bermuda grass. If you don't get it all, it's going to come back, and that's the way Lyme is. And then we walk with people through the Herx reactions. When you're first starting, you may find that you feel a little worse, so we will give you therapies or tell you what therapies to add that prevent some of those side effects that you're experiencing, to the point where after you do that a few months, you're like, oh, I'm starting to feel better. Slowly but surely, and to the point where like, oh, their symptoms are gone, and we see the labs that were abnormal in the first place go away. At that point, we start talking to patients a little bit more. We already mentioned at the beginning that Lyme doesn't 100% probably ever go away in anyone. They've done a lot of animal studies where they would give them Lyme with a tick bite or inject it, let them get sick, treat them for 2 to 4 weeks, and then go and do autopsies. Not a human study. Nobody's going to volunteer for that one. But for animals, the autopsy, and you can still go and find living Lyme disease in those animals even after they have been treated for a number of 2 to 4 weeks because it's still there. So you really don't ever completely get rid of it. So with that, what we're trying to do is control the symptoms. We are trying to help patients get the answers and get them to a point where, again, 8, 10, 12 months down the road after the courses, they're like, wow, I feel better than I can remember feeling, just because I never would have believed that it was Lyme disease causing that much trouble. So that is kind of how we approach Lyme, kind of walking through that so that patients can live that healthier, more abundant life once again, free of Lyme, and only having to know, oh, if those symptoms come back, we jump on Lyme quicker, because it may not ever go away 100%, but if we get you 99% better with the tools, what we call normative awareness, to listen to your body when it tells us, oh, something's happening, we jump on it and get you through that, so that way you don't go all the way back to the start. So with that, we have a question from Shay. What do you think of some of the main reasons for chronic headaches in teens? So, Teens, they're going through a lot of hormone changes. They're going through stressful times. They also are growing into some of their adult patterns and out of some of their childhood patterns. So we have fluctuating hormone levels. They also may be staying out later. Their circadian rhythms are changing. Sometimes they're not the best on going to bed early and getting up early. Sometimes they eat some foods that are not the most healthy, more processed inflammatory foods. So with that, what we are looking for is to see in that story, once again going back, as any functional approach is going to include, getting their story. And if we found out, oh, well, you're going to bed at 1 a.m. and waking up at 9 and sometimes 7 and sometimes 12, that irregularity doesn't allow your body to know when to have melatonin go up, cortisol go down, cortisol go up, melatonin go down. So that can be a trigger. If they're eating a lot of foods with preservatives like MSG, sometimes that's a sensitivity. For sometimes if patients have leaky gut or histamine sensitivities, they may find out that foods that release or contain histamine, a chemical we normally think of with allergies, can trigger headaches. So histamine excess in a food like fermented foods sometimes, or leftovers, or some foods, aged foods like aged cheeses, will have chemicals in them that trigger that response, and that migraine is what occurs out of that. Now, we would also look to see if they have any neurologic symptoms. So if it's, oh, they've got some weakness, we need to look for more things like the brain tumors. If they have a fever, we're going to think of more of infections, meningitis from virus or a bacteria. But outside of those emergency situations, we're thinking more about whether or not diet, lifestyle, food sensitivities, whether that's histamine or, hey, every time I eat dairy, it triggers a migraine because you either have some antibodies or some chemical sensitivities to that. Speaking of chemical sensitivities, it could be odors. It could be another thing that, oh, they started using a new cologne and that smell is actually causing issues. Now, beyond the simple things like that, we will look at Lyme disease. A chronic infection like Lyme disease may be causing some chronic headaches. We may look at mold toxicity. Mold toxicity could be another thing where, oh, you moved into a new house, you started a new school, a new job, and found out there's some mold there, is triggering those reactions. Allergies, just pollen allergies from the regular average mold, ragweed, pollen, oak, whatever it may be, can trigger some allergies, trigger migraines. So we look for those different things. We may look also for other toxins, like if they've got amalgams, looking for mercury elevations. Sometimes it's some vitamin deficiencies, so getting someone sufficient riboflavin or CoQ10 can sometimes make those go away. I have some family members who the riboflavin and CoQ10 has gone a long way in controlling that. So there's a lot of different reasons. Could be some hormonal imbalances, so too excess or too low cortisol from adrenal issues. Could be hormonal in terms of progesterone, estrogen, so around the time of their cycles for girls starting. It may be that the progesterone, serotonin is dropping, and if you supplement those things, you can find that those headaches do not occur, or at least not as severe. So there's a lot of different things in there that we would look at if we're thinking about teenagers with migraines. Seeing if no other questions for the moment. So if anybody, I'm going to go shoot from the hip for the moment, but if anybody has just even a topic that you want me to talk about how we address, I'm going to jump into GI issues. So if somebody's coming in so-called irritable bowel syndrome, irritable bowel meaning that you have some type of GI discomfort, bloating or pain that's usually associated with a change in bowel habits, whether it gets better or worse, and it may include diarrhea, or it could be constipation, or it could alternate between the two. But we're looking at someone who that distress is interfering with life. It may cause them to miss some events, miss some school, miss some work, or just lose some sleep over it. They will usually have gone to a GI doctor first, or tried some pharmaceutical therapies, or may have gotten a scope from that GI doctor where they do an EGD down the throat or colonoscopy, Or they may have done some blood work and said, oh, your inflammation markers are normal, your blood count's normal, your liver tests are normal, and said, oh, you've just got irritable bowel. Try this medicine and go on, or take some probiotics. Not necessarily a bad idea, but some people need more than that. So we'll take that story, irritable bowel. We will look, as we always do, for the things too much of something or too little of something. Do they have too much toxins? Mold can do that. Do they have too much yeast in their gut? Do they have too much of, say, Citrobacter or Pseudomonas, two different bacteria, and have dysbiosis? Do they have too much processed food? Do they have too much gluten? Some food trigger is causing leaky gut. Or are they missing something? Their diversity in their gut bacteria is too low. Are they missing a nutrient like zinc that's causing them to have some GI dysfunction? Are they missing a strong GI tract motility causing constipation because they have too little thyroid hormone? Or another too much is they could have had a viral infection. A lot of irritable bowel comes after viral infections. It disrupts, there's actually studies showing it disrupts the nervous system in your bowel that controls that squeezing, the peristalsis that moves things along. So we will look for those, too much of this, too little of this, work on patients getting a healthier diet. Sometimes it's removing the inflammation, sometimes it's removing certain foods, sometimes it's, a lot of times it's adding good foods back in there. So patients are getting some need fermented foods, some can't if they're sensitive to histamine. So what we're trying to do is find exactly what that person needs, remove or add, and over time, get them back to where their gut is functioning normally and they're not having all these symptoms. So that is a little bit of how we would approach someone with irritable bowel syndrome and possibly leaky gut or dysbiosis. Leaky gut being intestinal hyperpermeability, where the cells of your intestines are not tight enough and let things in, whether it's antigens or other issues. So with that, what we're looking for is root cause, and then we're trying to treat the whole person and use the best of conventional and natural medicines. Sometimes you need one, sometimes you need another. Most of the time, you may need a little bit of both at different times in the pathway. So that's one of the things we will do. All right. I'm waiting for those random questions, or maybe we can change this to Stump Dr. Potter and ask the hardest question you can think of and have some fun with it. Hey, I'm up for anything these days. It is 2020. You can ask me, how did the cow fly over the road without wings? It is 2020. That one I can't, you probably stump me on that one. I don't know how I did, except there's something about that 2020 that makes everything a little crazy. All the rules get broken. So with that, though, mast cell. There's another good question. So we deal a lot with mast cell. So let's talk about mast cells. Back to the immune. Hey, we're talking about immune system again. The immune system has a bunch of different cells that do a bunch of different jobs, all trying to coordinate using cytokine messengers where they talk to each other. Now, one of those cells that's somewhat in the middle of things is called a mast cell. Early on, when researchers found this, they thought, oh, this just has to do with allergies. You can get hives, you can get a runny nose, you can get a little wheezing from it. It's just histamine. Mast cells, however, have turned out to be a lot more important and sometimes are the field sergeants, meaning they respond and send out 30, 40, 50 different chemical messengers, some of which we know and some of which we're suspicious about and don't have exact chemical identities, to notify other cells, hey, there's a problem here. Come, or they will open up, cause swelling. That swelling allows more blood cells to get there, more immune cells, and cause you pain or cause you symptoms, say congestion, but it is trying to alert and bring in the troops. So these mast cells can do a great job if they're functioning correctly. They are alerting that there's an invader, and you need that in your body. You need the alarm bells to go off if an invader comes in, just like your alarm system on your home. However, if your alarm system never really turned off fully, and your alarm system, every time, this is a good example, You know, if you've got the outside alarms and there is a spider going across the camera on your video camera that sets off the motion detectors, or there's a bird that decides to build a nest up above that, your alarm system may go off countless times. So the mast cells, they can get touchy, meaning if they're in a hypersensitive state, they just need a little stimulus. There are those people who are cold, you put an ice cube and you can cause a hive on their arm. You can do what's called dermatography in some patients, meaning you can take your finger and scratch and they will have a red hive pop up within a few seconds or a minute on their skin. And you could, not to make fun of it, but there are pictures in textbooks of playing tic-tac-toe or writing words out on someone's back because those hives may stay there 30 minutes or a few hours. So with that, what's this mast cell syndrome issue? Well, there is a disease called mastocytosis. That is more of a cancer, so don't confuse it with mastocytosis, in which you have a overgrowth in the number of mast cells, and it can be even life-threatening, cause great damage. Very few people have that. It tends to be a little more genetic. However, many more patients have what's called mast cell syndrome. Mast cell syndrome is in which those cells are hypersensitive, and it may be temperature, it may be exercise can trigger these. It may be a food, it may be chemical sensitivities, it may be a viral infection that is triggering these. And especially in kids, a lot of viruses, kids will have these random hives and they'll go away, have a little fever, turns out it was a virus. However, in adults, you can get stuck where your mast cells keep setting off the alarms. And so then, kind of like before, you want to go in and find out what has pushed this mast cell to the point that it keeps to want to beep, set off the alarm bells and won't chill out. It can be toxins, mold, mercury, other metals. It can be infections like Lyme, Epstein-Barr, different viral infections may do that. With that, trying to remove those root causes. Now, in the meantime, we still want to calm things down. So we'll look at different therapies that we call mast cell stabilizers. Yes, we can use antihistamines. Antihistamines are, the mast cells have released the histamine. Antihistamines block it out here. The horse is out of the barn. They work okay, but what we want to do is keep that histamine in the mast cell so you don't have to block it. There's things, prescription medicines like cromolyn, sodium can do that. But there's also a lot of natural therapies like quercetin we will use. Curcumin helps some. There's therapies like alpha-lipoic acid. Glutathione sometimes helps a little with that. Things like chondroitin sulfate. Then there's other medicines you can do, and to the point of even doing IV infusions for antibodies against the antibodies which can trigger mast cells, but that is really end stage that rarely do you need to do. However, that can be helpful in those rare cases. So you're trying to calm down those mast cells as you're trying to get rid of the thing that triggered them in the first place. If you get rid of that, usually the calming, and they can go back to a more normal function. In the meantime, you also want any secondary triggers, chemicals, strong odors, perfumes, detergents, things like that. You may want to avoid those things so that you're less likely to trigger that. Now, where can those symptoms occur? Yes, you can just get allergy symptoms, eyes, sinuses, breathing, skin, having hives. You can also get a lot of GI issues. So it could be irritable bowel is triggered by some histamine symptoms. It could be bloating, could be pain. In the GI tract, you have a lot of mast cells. Anywhere there's a surface that contacts the outside, and technically the outside goes through your GI tract. There are mast cells potentially that could trigger symptoms. And then in those cases, sometimes we'll use antihistamines that you normally think of for reflux, like a Pepcid, or we used to use ranitidine before it got pulled from the market. But those medicines can actually turn down gut-related mast cell reactions. And so we'll try to control it that way. So with that, there's also a question about a link between mast cell and COVID-19. We don't know exactly, except that any virus has a potential for triggering. If somebody already has some mast cell symptoms, it potentially could make it worse. We're still learning about COVID-19. One of the interesting things, we're learning that it probably sticks around longer in a few people, called the long haulers. Not that surprising to me. We treat patients with HHV6, with EBV. CMV is another virus that can stick around. Obviously, we treat Lyme, as I talked about before. However, we'll see. COVID-19 may have some triggering for mast cell symptoms that comes out over time. I have to wait and watch for that one. All right, we've got a few more minutes here. If anybody has any other questions. Recommendations for working on gut health. All right, thank you, Mandy. So, gut health, somewhat central, meaning if your gut's not functioning, the rest of your body is going to have some struggles. It's going to have to overcome. For example, if your gut is not absorbing nutrients like it's supposed to, you're not going to have nutrients for your cells, your brain, your muscles, your heart, your lungs, your liver. If your gut is leaky and letting bad stuff in, your liver's got to filter that and put a strain there. If those things get past the liver, through the gut, and it passes the liver into the bloodstream, you can have more reactions. So we want to make sure the gut is healthy. So with that, that's one of the reasons why at Sanctuary, when patients come through, almost everybody gets some kind of gut therapy. Now, the ones that don't are usually the ones who are like, oh, you've already done a good job, you're already on the right therapies for that, but we might tweak something. But beyond that, most people are like, oh, you need to work on this. So the first thing are some of the simple things. Don't eat inflammatory foods. If you're eating a lot of sugar, if you're eating a lot of processed foods, there's going to be inflammation, higher chance of leaky gut, there's going to be more chance of symptoms. Now, once you get those things out, you want to put something back in. Healthy foods, high nutrient, phytonutrients. So it's not just what contains a vitamin, but whether or not that you're eating things that actually nourish the lining of your cells, lining of your intestinal cells. We want to make sure that those have high nutrients. So we'll look at things like using probiotics. We'll look at things like making sure your vitamin D level is good. Vitamin A is important for mucosal surfaces. Those things that kind of, once you go through your mouth, you start seeing the mucosa until it comes out the other end. With that, omega-3s, those are another thing we'll look at. Vitamin C is an antioxidant that helps that. Making sure someone's zinc is adequate. So nutritionally, a well-rounded diet, unless they have to be a food restriction. Now, if we find out, oh, they're sensitive to gluten, they're sensitive to eggs, dairy. We've had people that have bloody diarrhea from lettuce and cucumbers. So any food that seems to be causing a problem, we'll have them cut that out. So we may ask patients to do an elimination diet, meaning that you cut out a certain number of foods, do that for 6 to 8 weeks, and then allow you to eat those. If you feel better and you eat those again and feel worse, we know that may be causing a problem for you. Using digestive enzymes in some cases, not necessarily for everybody, but digestive enzymes are what your pancreas, your stomach, your intestine already make. Sometimes when there's inflammation, it can't make enough. Especially the inside lining of your small intestines have what we call villi, and they're like little fingers that stick out from the surface into the lumen, the opening of your gut. And much of your enzymes are out here on the fingertips, the villi tips. If you have inflammation and those get cut off, and it goes from what we call shag carpet to Berber, if you know what I'm talking about, it's kind of villi that stick out to ones that are flat, you can't absorb as well because you've lost a lot of your enzymes. So sometimes we'll use digestive enzymes. There's a number of good products out there. Not quite as picky because there's several that we can choose from, and patients are like, oh, can I use this? Oh yeah, that's a good one. No need to buy one from us when you've got one that works. So, or especially if they say, oh, it really helps, I'm like, yeah, keep taking the one. Don't switch to something that you're not sure if it works or not. So those are the things we'll do to work on gut health. And then also we want to make sure that people are turning down their sympathetic activities. So if you are sitting there eating and you're watching TV and you're watching the news, you're stirred up and you're chewing fast and you're swallowing fast, or you're having a fight at the dinner table, those sympathetic stimuli are going to slow down your gut, and you're not going to make as much digested juices and enzymes. So we want to make sure that you're slowing down, chewing your food well, enjoying food rather than it being a stressful time. So that's going to help the gut. Lowering stress, so dealing with stress. Stress can cause leaky gut because it triggers a lot of hormonal changes, things like adrenaline and cortisol that worsen the gut condition. And stress causing adrenaline can also feed bad bacteria in your gut. Certain bacteria like certain hormones. You don't want to feed the wrong thing. So those are some of the things we'll look at. We use 5R, meaning we remove bad stuff. We replace enzymes. We re-inoculate with probiotics. We try to rebalance, meaning your lifestyle, your stress. And then we repair, making sure that those nutrients I talked about earlier are in sufficient quantities to make sure that you are able to heal if there's damage or prevent damage from occurring in the first place. So let's do, I think, one more question. Other than the mainstream autism diagnostic evals from pediatrician referrals, what would be your first or other recommendations to look for 4-year-olds with continued developmental delays and speech delays? Thank you, Jessica. Now, I'll try to get both of your, let's see, I think, there's 2 Jessicas, so I'll try to get both Jessica questions here. So, what else would I look into for autism? So, toxins. Yes, there's some genetics, but even though genetics loads the gun, environment pulls the trigger. So we want to see if there's toxins like mold, mercury, aluminum, and then also lowering inflammation. If there's a chronic infection causing brain inflammation, it's not allowing the brain to develop correctly. Because one of the things that's believed to happen in autism is we know that our brain cells send out a bunch of connections and then pick out the ones it doesn't like and leave some behind. If you don't pick off enough, or if you pick off too many, there's problems. So inflammation can trigger either one of those, and toxins get in the way of the proper pruning. It's like if you're pruning a rose bush, you want to clip off places that let the other ones grow. That may not happen. So infections, food sensitivities like gluten or dairy, we look for the toxins, and then we look to lower inflammation are going to be the first things, without knowing the full story for your child or whoever's child it is would want to know what those things, what are those things we look at. And we'd look at also toxins in terms of if you grew up near a chemical plant, that may have some effect on children. And we can also look at some genetics that play a part, but that's not always the first thing we look at. And the other Jessica, let me get one more quick question from Christine. Low-dose aspirin every day. That can be protective, the 81 milligram being that low dose instead of the adult 325. And if you have some heart condition or predisposition, it's not a bad thing. There are also some natural alternatives. A good dose of vitamin E, omega-3 is a little higher dose. There's a product called nattokinase. I've not seen great research on it, but that is something that a lot of people use. I would not, take that for educational purposes only, as really all of this we're talking about today is not for direct health care, but this is for you to understand and also hear how we would approach things and get some ideas. Even if you never see us, you may take some of these ideas back to your own doctor and see if they can chase after some things. So the other Jessica, tuning in super late, but MCAS seems to go hand in hand with Ehlers-Danlos. Explain that link. What EDS patients can do to avoid MCAS symptoms while still managing pain and other effects. EDS, Ehlers-Danlos. That is a disease, partly genetic, but also can be environmental, in which there's hyperlaxity due to stretchy connective tissue that holds your joints in place. So those double jointed people that when they straighten their arm, it just kind of keeps going, or that they take their arm and they can touch their toes behind their back. I can't put my hands behind my back and put my fingers together, but I have patients who literally can put their hands together, reaching behind from bottom and top. Or the fun ones is where you can take your finger and touch it back here, or you can take your thumb all the way down here, or their knees kind of go backwards instead of being straight. So with that, That can be environmental, meaning there are some toxins that can cause that, and there are some therapies you can do. There's a Cusack's protocol, Cusack, a mom who had that in her children, family, and there's some supplements that can help. I've seen it help some, doesn't help to everybody. You would want to take that with a doctor's advice or have somebody guide you through that, whether it's right for you, but those are some things. Now, MCAS and Ehlers-Danlos. Some of the same genetics that put someone at risk for Ehlers-Danlos can put them at risk for mold toxicity. Mold toxicity can trigger MCAS. These are all immune-related. Well, the MCAS and mold toxicity are immune-related, and that immune system is functioning in your body, so it can cause some inflammation that keeps your collagen, the proteins that hold your connective tissue, ligaments, and tendons together, to be more stretchy. And sometimes by treating those things, those ligaments and tendons get better. Now, why would it be wrong to be super stretchy? Well, if your joints pop out of place, if you get sprained ankles, if you have a lot of joint pain chronically because they're going beyond what they were really designed to go. So I have not seen perfect research linking those two, but I have seen a little more Ehlers-Danlos or hypermobility, at least in patients with mold toxicity. And there's some genetics we test for that may indicate that. And we cross over again with mold, and MCAS. So hopefully that was helpful. I think you're welcome, Mandy. So it is about 6:30. I'm just going to wrap things up. I've enjoyed our time together. I look forward to more of these more often. I enjoy helping people understand their health, answering their questions, and also, like I said at the very beginning, I want to help as many people get the help they need. So I don't want there to be barriers to people living a healthier, more abundant life. And even just by educating, teaching you what you can get out of your doctor or how you can make some improvements to your health, then I can go to sleep tonight knowing that I've helped others. So thank you for joining. If you'd like to come back, or if you'd like to bring more questions, or tell others about next Thursday's time at 11:30 to 12:30, Facebook Live again. We'll be answering more questions and talking about what we're maybe telling a few more things, announcements of what we're doing at Sanctuary to make others live a healthier, more abundant life. So thank you for joining us, and everybody have a wonderful, blessed night.